So my name is Lauren Mansell. I'm a physical therapist that specializes within pelvic rehab, oncology, and lymphedema. I am here to talk to you today about lymphedema of the breast and the trunk. So I'm going to teach you some helpful tips on how to manage the fullness and thickness that comes with lymphedema of the breast. Additionally, I'm going to show you how to do a quick self-manual lymph drainage, and then after that, I will show you how to wrap. So, first for a few things, you don't have to wear a shirt like this, but this is to show you what the lymphatics, the superficial lymphatics, how it breaks up and how we can help you drain your own breast and trunk. Secondly, I have a compression tank top. These you can buy anywhere. This one was from Target. And it's a Spanx brand, so it's 2 layers of compression. They also have single layers of compression at TJ Maxx and Marshalls. There's a specific brand that I really like called Marilyn Monroe brand because it has a very high armpit. On this compression tank top, you can see that the armpit is actually a little low. So in certain brands, there'll be a higher armpit, and that is very, very helpful. So I'm going to go ahead and place this on around my waist just to kind of get ready for when we're going to do the wrapping portion. So, all right, a quick kind of, I want to talk a little bit about what happens when there is lymphedema. So we have, this here is body, and there are 2 layers of your lymphatic system, and your lymphatics travel along with your arteries, veins, and nerves, and it picks up any larger particles that your veins cannot pick up. So, you have different quadrants of how your superficial system, more on the outside, drains. So here you can see, this is my drawing of a person, and so there are a few things that we want to kind of discuss, is that there are quadrants that drain. So this quadrant drains to that right armpit. This left side, so there's the clavicle, there's the umbilicus. This left side drains into the left axilla. Head and neck drains in the neck. And then also the legs drain here into the inguinals. So we can even draw those in very well. So the draining areas are here, here. So right in the crease, right in the crease. And then you have different systems that come through. So these are the interaxillary. So even though this whole quadrant will drain into this axillary, the axillary processing center. So even though it will drain here, if there's an issue, if there's been lymph nodes that have been removed, or if there's been radiation, you can push any kind of congestion that's here over to this side or down this way. So, also on my shirt, same way, is as you can see, we have the different kind of demarcations. So here at the clavicle, will drain from this whole arm, breast, and the back, will drain this quadrant into this armpit. So when you have right breast cancer, and let's say you have a scar, you're gonna push around the scar, and you're going to move it to another processing center. So if it makes sense that this processing center, this axillary lymph node area, is no longer processing as well as it was prior to cancer treatment, that being chemo, that being radiation, that being lymph nodes being dissected out. So what we will do is we will move any congestion that's in this quadrant either down towards the inguinals, here, so if it's my right side, we'll move it down this way, or we'll push it across this way. If you come and see a manual lymph drainage, if you come and see a certified lymphedema therapist, you may also have the fun of having the massage going across the back to this axillary lymph node. So, to show you a little bit of the self-manual lymph drainage, let's say, we'll kind of break it down to left and then do right. Let's say that you've had a right mastectomy or partial mastectomy, which is also called lumpectomy, And so we have some swelling that's right here underneath the armpit. So what you would do is you would start with really good deep diaphragmatic breathing, and that's on another video. We start with the deep diaphragmatic breathing, 5-10 minutes, just to get the deep center of the deep layer of the lymphatics very stimulated and allowing to absorb that extra lymphatic fluid coming from the massage we're going to do. Then you're going to want to massage wherever you're pushing that fluid to. So we're going to massage right in the crease, here in the inguinals. So if you remember, over, we're going to massage here, and we're going to massage here, because our swelling is in this quadrant, essentially right here. So we want to push that way and this way. So we're going to do nice big circles. You can't hurt yourself by doing this. You can do maybe 10 clockwise, 10 counterclockwise. Doing that nice deep breathing. You can do this lying down, you can do this sitting. Then you're going to go to your opposite armpit. So you're going to be pushing over to this armpit. So you're going to do nice big circles. And then change that circle. So we're prepping the areas that we want to push the excess fluid towards. All right. So, and then you'll kind of decide on your body and your arm length and your flexibility what works best for you. But what we want to do is start kind of creating, there's that channel right there. So we're going to, and remember that you drain in these quadrants. So we want to push past this boundary, and then we don't want to push past this boundary. So as you kind of open that area up, you're going to start pushing and like unparking the cars. Now you're massaging straight on your skin for decency. I'm pretending that this is skin. You can do nice fluid movements. You can do little presses. You can even do little circles, half moons. You can change your arms. Hand placement, excuse me. Right here is where you're going to feel the most of the truncal edema, or even in the breast. So you're really going to spend a lot of time pressing this swelling down. This is really nice and sitting. Whenever possible, try to use gravity as your friend. So if we're pushing this way, that will do a little bit. You can try lying on your side. It just depends on what's comfortable for your hands. As long as you're not having pain, everything is just fine. Again, always seek help with your local certified lymphedema therapist. So we're starting to decongest this area. A lot of times with breast lymphedemas, we'll get a lot of swelling here at the bottom of the breast, and it'll look like orange peel. So what we will do is, in our protocol that we've created, is we divide the breast in half right along that nipple line. Remember, we already kind of opened this area up, so we can start pushing the swelling that's here down these other avenues. So we're going to start kind of opening up the area, pushing that swelling over. So you're almost pushing through that breast, or kind of right on top of the breast. I really like a kind of firm handful. You engage the skin and then kind of push into it. With truncal and breast lymphedema, you do have to use more pressure than the usual skin stretch. So when you've worked with a lymphedema therapist, they may have shown you how to do a skin stretch, which is fantastic when the swelling is superficial in the arm. If it's deeper, you have to go deeper. Specifically in the trunk and in the breast, you have to use a firmer pressure. So we're starting to decongest this breast. So if you could tell, I'm dividing right there at my congested breast. I'm going to go under. And if you had a full mastectomy, you'll find this over your scar. And it's pressing right on through. And then we want to bring this, and feel free, you can bring the whole entire, you can really maximize this anastomosis, it's what we call call it, this pathway, or you can utilize this pathway. So if it's more comfortable for you to press through the breast, kind of going down, it's completely fine. You really want to spend a lot of time. You can use moisturizer. We recommend Eucerin because it's got a lower pH. You can use any lotion that you're not allergic to. You don't need to have lotion. You can just use skin on skin to press that fluid out. Massage, you'll feel a difference with massaging that fluid out of the breast. Again, if there's any questions, reach out to your physician. Look up a certified lymphedema therapist in your area. Bring in this video if you so chose. So we're kind of pressing sideways. If you come in to see me, I use this back anastomosis because after all of this treatment, you should get some nice, good feeling back manual lymph drainage. I won't say massage because massage is not covered by insurance, but the manual lymph drainage will utilize on your back. So this is self-manual lymph drainage of the breast. So same thing if you had a left breast cancer, wherever your scar is, you're going to want to really make sure you're massaging that scar. As soon as that scab falls off, you can do some massage there. Then remember on this side, so now we're switching and we're going to the left. So we're going to recreate our model here. So now, if this is the left breast is where we had our breast cancer, we know that these lymph nodes have either been dissected or they've had a radiation, or even we've seen some issues with chemo. So if these lymph nodes are not working well, then we have to open up this one here and this one here. So that way we can push the congestion in this quadrant over that way and then down this way. So again, you start with the deep diaphragmatic breathing, which again is in another video. And then you start to open up the areas that you're pushing, so you're going right in the crease. 10 or so big circles. You could do more, you could do less. Nice big circles. And then you're going to also open the other axillary. Nice big circles. And then you're going to unpark those cars. So whichever feels more comfortable, you're again going to start to use your pathways. So you're going to start unpacking the cars. Circles, presses, whatever feels good. The more you do this, the more practice, the more easy it'll feel. Then you're going to unpark these cars. So you're just going to stay as close to it, bringing any kind of fluid. And then remember, we're going to divide that breast approximately like halfway through. If you can, you're going to press through from the left breast over to the right axle. And then we're also pressing down. You're going to spend just a ton of time here because this is where truncal and breast lymphedema is probably where it stems. I think sometimes we've got some upper extremity lymphedema additionally that comes from a backup from the system here. So just massaging, getting all of this fluid down, make sure this feels nice and soft. Spend a lot of time underneath the breast to help soften. Always ending with deep belly massage, deep diaphragmatic breathing, and that's a different video. So that's the self-manual lymph drainage of the for breast and truncal lymphedema. Next, I will show you how to wrap. So that's why I put this compression tank top. So we've got the tank top. You want to get one ready because this will help keep it up. You want to have, can you throw me a tape? So I like 2 10 centimeters. I will drop these multiple times, I'm sure, during this video. I know this happens a lot. You want to start with a nice roll. This is short stretch. This is Comproland or Rosidol. So you have your 2 short stretch bandages. You want to get a whole bunch of tape ready.
torn, is there a certain type of tape you recommend?
The best tape is duct tape. We did not have any duct tape at my house or in my garage today. Actually, I cleaned out the garage and I put it somewhere special. So duct tape actually works better. This is paper tape. We also have cloth tape. So these are medical tapes. You can even, I've had patients use regular like gift wrapping tape, scotch tape. But the best one to use, and it's not that expensive, is the duct tape. So again, we're over skin, or if you want to wear like a tank top when you go to wrap yourself, it's completely fine. You're going to take the short stretch bandage, and whenever you roll, you want it to be like a snail, like this, so that it's always coming out, the wrap. Otherwise, this way is very cumbersome. So if you're at home, it's the first roll is hard to do, so you almost want to, if you have someone who can help you, great. Again, work with your certified lymphedema therapist. They can help you do this. So that's my first wrap. Now notice I'm not pulling this tight. All I'm doing is going circumferentially around my chest. You can do this with mastectomy. You can do this with a lumpectomy. And you're going to tape it at the end. So I didn't want to tape onto my skin initially, so when you do the second one, so that one I went clockwise, and I'm going to go counterclockwise around my body. So you can stabilize with some tape, which really helps with that second roll. And practice on this, it's, you know, we all have different flexibilities. I actually don't have a lot of flexibility in my shoulders, so you'll be surprised by what you can do with practice with this. And then going to securely tape that, and then take your compression tape top and put it over to keep it nice and secure. So I really like when you can get the compression tape top really high into the armpit. And then as you're breathing, your deep belly and intercostal breathing, it'll help pump that fluid out. You can make certain pillows. Coming off screen for a moment. I'll be right back. So these really great pillows at our hospital. Our volunteers make these for us. So you can use these under the armpit. You can use them over the drain scars. You can wrap them. You can put them underneath to provide more pressure if it's left breast lymphedema. Likewise for the right side. You can also utilize some swell spots that you can get on Amazon or through your local durable medical equipment. Again, questions on this, reach out to your therapist. So this is a breast that you can wrap over. This is called a swell spot. We can also make these with stockinette and cutting out foam. So there's a lot of things that we can do. I very often recommend that patients bring in their unmatched socks, and we'll roll them into balls and we'll place them in between the breasts to provide pressure on the breasts with lymphedema. So we've got the swell spot. This one, I really like this shape because if you have swelling, you can have swelling that is in that entire quadrant. Remember, the picture is just of the front of the body, but in the back of the body, it's divided there on the spine also. So you can wrap a swell spot in that way. All right, so just to go over, we went over how to do a little bit of that massage, how to, well, step back, we did a little general information on your lymphatic system. When there's been any kind of lymph node dissection or radiation to one area, we need to push that fluid to other areas that are intact. We can do that with massage, we can do that with compression. There's pumps out there that are really great to work with. So again, please reach out to your certified lymphedema therapist in your area. Reach out to me personally if you have questions or concerns, because lymphedema of the breast and trunk is a very big problem that we're not addressing, that we're not talking about. So any kind of discussion on this is great. If this is for educational purposes only, so I'm not prescribing it to anyone specifically. I want you to feel comfortable doing this. I want you to have an understanding of your breast and your trunk and some of the